Welcome, everyone. Welcome, everyone. Thank you for joining us for today's live briefing about HSTA's recent agreement with the employer regarding increasing the number of students on campus in the fourth quarter. I'm Rosenlee, your HSTA president. Joining me today are Lieutenant Governor Josh Green, and Dr. Kimball was supposed to be here tonight. Unfortunately, she couldn't make it, but we're lucky to have Karin, and she's got a long title, which is, I will say this, the School Liaison from the State Department of Health's Disease Outbreak Control Division. Okay. Today, we are going to speak with Lieutenant Governor and Karin about the recent updates and changes from the recommendations from the CDC and the Department of Health about COVID-19 in schools. Later on at 6 o'clock, we're going to be changing pace. Deputy Executive Director Andrea Eshelman will be joining me to be dealing with specific contract questions about the recent agreement. We also are lucky to have HSTA's Vice President Osa Tui and Secretary Treasurer Logan Okita, who are off camera. They will be monitoring the comments in Facebook and our YouTube feeds, and they'll help compile a Q&A at the end. So we encourage all of you, as you're watching this, if you do have a question, to put that into the comment section so we have a chance to ask Lieutenant Governor Green and Karin Ng. I'd also like to thank Kelly Ka'ana from Leeward Chapter, who will be also helping us keep track of all the questions as they come in. So with that, I just want to say to all of our members that the decision to bring more students on campus was a difficult one. We have heard from members on both sides of this issue very passionately on this issue. But the issues that were resolved, that came up, that had to be discussed, number one is that Hawaii has the lowest case rate in the entire country, that most of our teachers have had the chance to get vaccinated, and that parents had a choice. So the parents that felt it was safe for their child to come back to campus, we felt like we had to accommodate that. But we also wanted to make sure that it was safe. Now, the reason why we've divided up the presentation today is because there have been a lot of questions around that question of safety. And so before HSTA talked about it, we wanted to hear from the experts. So with that, I'm going to first turn it over to Lieutenant Governor Green.
Thank you, Corey. I hope everyone can hear me okay. First, let me just say thank you to you and to the teachers, staff, all of your educators. Thank you for including me. Thank you for welcoming me. Thank you for having such a good relationship with me. I really value that. And one of the things we talked about a long time ago was always being available to you. So not only will I be available tonight, but going forward, if people have questions, I hope you will text or call me and I'll make sure you have that information before I go. I'm going to give a couple quick slides, opening comments, just so people can see where we are, if that's okay. And as I bring that content up, I'm going to speak to you just obviously as friends and family, but also I'm going to try to put my medical hat on. I'm an ER physician. I'll be on call this weekend. It's actually on call last weekend. 2 weekends a month I serve in the ER on Big Island. And I've seen a lot of COVID. I had COVID personally back in September and have had the vaccination. So some of those perspectives will probably be included tonight. Now, from the perspective of where we are as a state, and Corey mentioned it right off the bat, we have, and this, you can see this quick slide, from in the last week, we had the lowest rate of COVID in the country by a pretty large margin. We're all the way there on the left, 24.7 infections per 100,000 people. So what does this tell us? This tells us that not only are we better off than the other states, but we have an incredibly low viral load, a low amount of virus in society, which means that it's less likely that we will catch COVID if we're in close proximity to someone else who's sick. So that's very important. Because most important to me is that our educators and staff are safe, frankly, and that we can go back and educate our keiki the way we love to. Here's a look at the entire pandemic from March 7th, 2020 till March 13th. So just a couple days ago here this year. And again, you can see we have by far the lowest infection rate in the country. Some states are 4, 5, 8 times higher than us. So that's been a benefit to us. We've been healthier, and it's also an indication that we do have the capacity and have had the capacity to stop COVID from spreading much better than anyone else because of the many things that we're recommending today to our faculty. Now, let's move forward to look at the most important thing perhaps, which is what the death rate is, the mortality rate is. This is for the last week. We were second lowest only to Alaska. And if you look forward to the overall pandemic, we've again by far had the lowest mortality rate. 451 of our people have passed away. They've almost always, but not completely always, almost always been much older. The mortality rate for people who are 80 years old and above, as compared to people who are in their teens, 20s, and 30s, is several hundred times higher. Older people suffer very terribly. And it's not lost on me that this is not just about you. I know many, many teachers, and they have told me they're more than happy to go back or be even exposed to COVID, but they worried about what it would mean to their loved one, to their kupuna who might live with them, to the other people that they're with. And that's a very compelling and important position to have, and I respect that. But again, the good news is we've had the lowest infection rate and the lowest mortality rate in the country, so that we are a lot safer than many other places. Very quickly, I'm not going to dwell too much on this because I want to take the time for questions tonight. It's had a huge impact. Having COVID means that now 1 in 4 of our people have had to go onto Medicaid. That number actually has surged down to 400,000 people because the economic consequences were great. A lot of depression occurred and food insecurity, in addition to housing insecurity. And that has been a profound worsening of some problems that we all wrestle with here in Hawaii. And that's almost been exclusively due to the economic impact of COVID, which we're sensitive to, but that doesn't mean we take risks with our loved ones. A quick comparison, the days after the holidays, Christmas, New Year's, showed that we had much higher numbers. We were at 105 people in the hospital as opposed to today, 21. Our case count was almost 3 times higher, 139 on average compared to 56. And you could see that the positivity rate and the prevalence rate in each of the islands has been dropping steadily. So it is very low. And when you imagine the total number of active cases right now to be 781, which is the exact number of people that have been tested positive, that 781 out of 1.4 million means that only about 1 out of every 2,100 individuals right now would be confirmed COVID positive and active with disease. Now, it could be higher, of course, people don't always get tested, but that means the likelihood of catching COVID is very low, extraordinarily low if you've been vaccinated. I'm not going to lie, I'm a proponent of vaccinations. I'm a family doctor and an emergency room doctor. Here's where we are. As of this morning, we had given 504,891 doses. We've also made sure that we gave a preferred status to our educators, because you are with children, you're with multi-generations of people, you're with parents, and you're exposed if you're with children in the classroom. And it's important that if we ask you to go back, that you're safe. We're in the 1C category right now, and we're accelerating the vaccination process so that I can tell you that by April 1st, we will exceed 600,000 doses given. By May 1st, we'll exceed 900,000 doses given in the state. And what's not reflected on this slide is that we've also done 90,000 shots to the military. And they keep separate records, but that's additional immunity that we have in the community. Obviously, I'll share this with the team afterwards if you'd like. Very quickly, this is how it broke down, so you can see the approach to try to make our entire state safe. 1A was 40,000 healthcare workers who were in direct contact with people who were infected or infectious, and 10,000 kupuna living in nursing facilities, the most likely to die from COVID. 1B, those individuals 75 and older, which was 109,000 individuals, and 50,000 individuals working in extreme close proximity to others. And here's what that group looks like. The frontline essential workers, right off the bat, we deemed, and I, as you can see, I put it into a box, teachers in childcare and educational support staff, meaning childcare, preschool, early education, K through 12, post-secondary. So you were deemed frontline essential workers at the top category, right after the healthcare community and the most vulnerable kupuna. So that was important to me personally, and I hope that that's helpful. It's not perfect. This situation is not perfect, obviously, but it is still important that we recognize where we are as a state. 1C category has now begun. We've added 65 to 74-year-olds and individuals with health problems. specifically severe health problems right now. That's needing oxygen, being on dialysis, or receiving chemotherapy because they are suffering from cancer. And we will be expanding this next category in about 10 days to go to all individuals who have chronic health conditions and very likely the 55 to 64-year-olds. But by May 1st, we expect to be open fully to vaccinate anyone who asks for it, per what President Biden has asked us to do, which we respect immensely. There's the 65 and older, which we began on March 15th. We really respect and appreciate Director Char and her work on this. She's been very helpful. Again, none of us are perfect, but this is the process that we've been going through. A couple last moments, here we go. Couple last slides. May 1st, 2021, every adult over age 16 can get the vaccine. 16 is the lowest age that a person could be vaccinated based on the studies right now. Pfizer's vaccine has been allowed to go down to age 16. And we expect this summer, actually, vaccines to be approved to probably age 12, maybe even lower. The studies are going on right now. So those trials are underway. That would be phase 3. If people still have challenges getting the resources that they need, it's hawaiicovid19.com. I'm going to share with you my cell and put in the box also, which is 937-0991. If you have a question, have a teacher, I have a question. 937-0991. It's a Big Island cell phone number. And overall, the social media links too, if you need to get me. I like to share that because I give an update every day. You can ask questions or get me or find me somehow, but you can go right to my phone. Now, I'm going to stop sharing the screen and just say a couple more things, if you don't mind, Corey. Look, there are many questions you're going to have. One, of course, is what's the deal with the 6 feet? Well, there are idealized approaches to stopping COVID. The most ideal is, number one, that people have masks on. If both people have a mask on, we have a 99% plus probability of preventing spread if one of them is positive. So if we're wearing masks, we're very good. Number two, if we're able to socially distance, which is going to be a challenge, I recognize, for some of the schoolrooms, some of the classrooms. But if you also have masks on individuals, it's very unlikely there will be spread. And that's why the CDC has said you don't have to have every checkbox done to be safe. Then finally, if people are vaccinated, it's extremely unlikely that you can catch COVID. People who have gotten the Moderna or Pfizer vaccine are over 94.5% protected from COVID. And if they do catch it, if they're in a minority, a very small minority, their disease state is minimal. Same thing can basically be said of Johnson & Johnson, though the rate's a little lower. So those combined forces, not to mention the fact that if we're doing a good job with hand washing, we just don't see much spread. And that's why when we were locked down or when we were honoring the mask wearing and whatnot, we saw very few cases, very little disease. And so from my standpoint, it is safe. I have been in close proximity to a lot of people, whether it was in the hospital long before we had any of these opportunities to do extra protection or not. But it is safe, although it's not perfect. I would say this, though, if you are a person on this call and you're vaccinated and you're going to wear a mask as well, you are safe. I would have no worries about you at all. If, however, all of these different systems break down and you did not get a vaccine, then I'd have concern that you could very well catch COVID. Children have not manifested COVID very severely. There have been a lot of asymptomatic cases, so it's an invisible situation. But if you've been vaccinated, you are safe, in my opinion, and I feel very strongly about that. I would not ever condemn anyone to an unsafe situation, not as one of your leaders and not as certainly someone who cares about teachers. So I'll stop there if you don't mind. And then
Thank you.
You ask what you need from me and I'll be here.
Okay. I also want to give a chance to Karin to say something. And I'll just say that I can see that our questions are blowing up already. So go ahead, Karin, I'll turn it over to you.
Thanks, Corey. And thank you, HSTA, for having me. The Hawaii Department of Health recognizes multiple health benefits of children attending school in person, including first and foremost the fundamental links between education and long-term health outcomes. In-person instruction is particularly important for younger children and those with special educational needs. Social and emotional support resources made available on school campuses are also critical to the health of our keiki, and for some families, food security is provided through school meal programs. All of these factors must be considered in the overall health benefits of in-person learning. As we learn more about COVID-19 in schools, it has become apparent that schools are not amplifiers of COVID-19 transmission. Instead, schools have implemented mitigation measures that are able to control COVID-19 transmission much better than many community settings. The Hawaii Department of Health COVID-19 guidance for schools is intentionally layered and flexible. The Department of Health has identified some mitigation strategies as core essential strategies, and these core essential strategies are strategies that are so effective that in-person learning always requires these strategies to be implemented. Core essential strategies include directing students and to stay home when sick, and consistent masking, and performing good hand hygiene. Other strategies should be applied in combination to the greatest extent possible, and these strategies include cohorting, physical distancing, improving ventilation, installing physical barriers, and cleaning. Provides guidance for schools to help protect students, teachers, administrators, and staff to slow the spread of COVID-19. The goal is to prioritize the reopening of schools as safely as possible, given the many known and established benefits of in-person learning.
Okay, thank you, Karin. Okay, so I'm watching the chat. I'm getting a lot of questions, but I would say that the most popular theme, of course, is this. How do we say that in social distancing, every other part of our society is 6 feet or more, but we say it's okay to have less than 6 feet for our schools and our keiki? So how would you respond to that?
I could start. So we recognize, and this is something that we press the CDC very hard on too. And I'm not saying that they're the only objective body in the discussion, but the recommendation has been to do our best to socially distance that in that great a distance. Had we not had a vaccine, had we not had the capacity to know that masks are stopping the spread, I think it would be impossible to make the recommendation where there are going to be times where we're less than 6 feet apart. And we also know that the children themselves are often going to be less than 6 feet apart because they're kids and they're going to be together. Now, the teachers will be able to control that to a degree, but not always, especially, I think, in our special education classes, especially where kids are younger. I mean, and especially when you got to hug the kid. I mean, that's just something that's obvious. It happens. But I think that the teachers will be able to control the distance pretty well. I think that there may very well be some spread between children, although, as we just heard, there has been less spread often in school settings than there has been when kids are out of school and they're completely unsupervised, or they're not given kind of good guidance on best practices. So I think it will be safe. I would not cram kids into classrooms, of course. And if a situation seems unsafe to a teacher, principal, that's something that we should immediately work through. If we find that some classes are just too overwhelmed. But there are many settings across society where people are less than 6 feet apart routinely. Grocery store settings and restaurant settings have very frequently had people less than 6 feet apart. And those settings also often don't recommend themselves to mask wearing, like restaurants. Yet we have not seen significant spread. Churches are another case where a lot of people have sat much more closely than we would like, but there hasn't been significant spread. So these are just some considerations. But again, if you're wearing a mask and you're vaccinated, you do not have a problem. Others may, but you will not.
So let me follow up with another question then on sort of a similar thing. Teachers are sharing that schools in their cafeteria are doing less than 6 feet and they're not doing masks. And they're sharing their deep concern that how does if we say that it has to be under 6 feet and you have to wear a mask, and then all of a sudden we're allowing students to be less than 6 feet without masks. So Karin, how would you respond to that?
Yeah, and just to add to Lieutenant Governor Josh Green, he's right, and we see schools as their own kind of contained community in a way. And this being that the students and staff are in a more controlled setting than any kind of just public setting. So schools have been working really hard at implementing the mitigation measures, which makes schools a safer place. And that's one reason why the distance in schools may be less than in the general public. In regards to instances when masks can't be worn, such as when eating in the cafeteria, the Department of Health, we recommend these layers of mitigation. So masking is one, but when it can't be worn, then you have the physical barriers as one of your layers of mitigation. So we do recommend to schools to use physical barriers such as plexiglass dividers and even face shields only for the purposes of eating as a physical barrier.
And to add to the reason for the physical barriers, which they are not perfect, right? We know that, but this is a droplet-borne and an airborne to a degree, but a droplet-borne, heavily droplet-borne disease. So sneezing and coughing from children is one of the ways that it would spread. So if you do have a face shield, that is quite protective to a degree. It's not of course, it's not the recommended only version of barriers. And we ask our children, in an ideal world, to have both the face guard and the mask. But there will be some time, just another definition, I don't know if this is helpful, but the definition of a close contact with someone who has been positive is less than 6 feet apart and for more than 15 minutes if they were positive. That's what triggers us to have a much higher risk of catching COVID. So provided that children are healthy or that we are healthy and we're not positive, it's not a worry. Even if someone was asymptomatic, if you spend a few minutes in their company and you're less than 6 feet, you still are unlikely to catch it until a certain amount of time has passed. But again, it's not predictable or perfect. So the more barriers, the more opportunity to spread people out, the better. I would recommend get vaccinated. That would be my bottom line, best protection at this point.
So just following up on that one, would it be safe to just have a face shield in a classroom and not a mask? And if it's not, then why would that be safe in the cafeteria? That's a question we've been getting.
So it's not as safe to just have the face shield. It is just a function of what we have to do, how we have to function if we're going to have a meal during the day. And in the case of the lunchroom, then our best bet is to spread our children out more if possible. I know it's not completely possible, but to the extent that we can, or keeping them in their same bubble, then it's a good approximation of safety. But the best and standard of care is to have a mask and a face shield. And the reason for that is the mask protects the other person. It tends to protect the other person from any coughing, sneezing, breathing viral particles. The face shield is meant to cover the mucous membranes of the eyes and the nose better. But in combination, they're good. You will have some small risk. Again, if a person is not actively symptomatic, they have a pretty low viral load for the most part. And if a kid is sick, if one of our keiki is sick, we obviously insist that they stay home and not come to school, and we would recommend they get tested. So there's still lots of additional mitigating ways to stop the virus long before we ever worry that a face mask with or without an actual mask during lunch will be a risk.
Okay, so I'm going to jump in. Logan, I know I can just watch it. There's constant questions coming in. Logan, what do you got for us first?
Let's see, we've got a lot, and I'm going to apologize to start with because I know we won't get to everybody. What is the maximum number of students you would consider as qualifying as a cohort?
Karin, what would you classify that as?
We haven't defined a number. It's really just how many students that you can keep together successfully in that cohort. And cohorts are important because in the event that there is a case identified within the cohort, if it's especially with younger students, if they aren't always seated, that way for the purposes of contact tracing, we'll be able to know who may be considered a close contact if you keep them together in that cohort. So we really haven't identified a number. It's really what is feasible, that you can keep those students together and identify that only that cohort was together.
So Karin, let me just follow up on that one and ask then. So if you don't need to maintain 6-foot distancing, and could you have 60 kids in a library, for example? I mean, is there any guidance there?
Yeah, so the 6-foot distancing, some of you may have seen, there's that study in Massachusetts where they're even thinking maybe even 3 feet may be sufficient to help prevent transmission. So it really just depends. If it kind of depends on the age. So if they're the kind of classes that are usually younger classes that are not in their seat, mingling more, then it's being able to identify who may be a close contact in the event of a positive case.
Or maybe think about it this way: if a classroom is a family reunion and there's 20 or 25 members of that family that are together a lot and frequently for the week, the month, 2 or 3 months, and they respect one another, they're less likely to spread the disease. If you have 2 family reunions together, suddenly they may not know one another and there's a higher risk of spread, and you also don't know what happened to one family or another. So to the extent that you can keep that family cohort together and consistently as a part of that cohort, it'll make it easier to deal with whatever may come. So I would always try to not mix too many of these bubbles, essentially, or these family reunions, if you will.
Okay, thank you. Logan, what do we got next?
So along those lines, if we're seating students less than 6 feet apart, for example, say 3 feet apart, are they then in that classroom all considered close contacts?
In the event of a case, if it's not clear, we do provide guidance of who would be considered a close contact. And if we collaborate with the school on identifying those close contacts and notifying them. But in the event that there may be some uncertainty based on the criteria we provide, Department of Health works closely with that school to identify who may be a close contact and who isn't.
Oh, hey, Josh.
Okay. Logan, what do we got next?
Thank you. So if teachers are deemed safe, if they are vaccinated, what about our families? If we're coming home to a family member who is not vaccinated, what's that kind of risk?
Extraordinarily low. So if a person is vaccinated, we have now seen studies out of Israel, Iceland, different parts of the US, that there's an extremely low asymptomatic carrier rate. In other words, a person won't catch COVID 95% of the time. If, however, they have any virus on them or in their upper respiratory membranes, it's a very low viral load. And so we now believe that it is both protective against catching COVID and carrying COVID. And that's why you're about to see major guidance from the CDC saying that it's okay to travel, also that if you're vaccinated, and also that if you saw the notes that came out of the CDC recently that said that if you have been vaccinated, you can be around other people who are vaccinated without a mask because they now feel that it's very safe. So again, you have provided protection, and our family members should all be getting vaccinated soon as we finish off the vaccination program.
Okay, I just want to remind everyone that's watching that we're trying to ask the medical questions until 6, and at 6 we're going to switch to having our Deputy Executive Director, Andrea Eshelman, on, which will be answering contract questions. Okay, Logan, what's our next question?
So this one reaches out to me in particular. If we don't need to keep the students 6 feet apart in the classroom, do we still have to keep them 6 feet apart outdoors at recess? And should they be wearing their masks at recess?
Karen, what would you say is the answer to that one?
Yeah, so masks are recommended at all times when feasible. And if it's a cohort that is already mingling together, then I think the same rules for the mingling between the classroom and outdoor would apply. That's just saying that the cohort, if there were a case, then everyone in that cohort may be identified as a close contact in that case.
But
Okay,
they should
Logan?
wear, they're safer outdoors though because of the open air.
Lieutenant Governor, you're
and
breaking up there. I think you're frozen on our screens.
Ventilation can be allowed in schoolrooms.
Lieutenant Governor, we can't hear you.
Doors open or the windows open. Oh,
Okay.
Sorry,
Okay.
I'll just go a bit. I'll go audio only. It's safer outdoors.
Okay, I think we lost you. Logan, why don't we
I
go
was
to the next
saying that-
question?
Okay, so the next question is in regards to contact tracing in the community and testing. So will school employees be tested weekly? And how are we contact tracing throughout the state outside of our schools?
So our guidance is for schools to implement testing in certain situations, especially if there are people with symptoms of COVID-19. We do recommend that schools provide referrals for diagnostic testing. In terms of getting tested, any kind of schedule, I might have to defer to, I don't know if that's DOE, or I don't know if Lieutenant Governor, you can answer that.
Can people hear me okay?
You're a little
Can you hear me okay, Corey?
jagged.
Okay, I'll just try. There's no recommend. There we go. I hope that helps. There's no recommendation for routine testing, although I really think the recommendation should be if anyone has any symptoms whatsoever, but I would not be against routine testing. It's completely okay if schools want to engage and have extra tests done. It's not necessary though, especially if people have already been vaccinated. Routine testing for asymptomatic people will be almost useless.
Okay.
And then a
Logan,
continuation of that, why can't cases be reported by school instead of by complex areas?
So one reason we're not reporting by school is, especially with the smaller schools, it may be an identifier of the actual case, which is not information that we want known. Also, it may cause undue panic for anyone within that school. Department of Health works closely when they're with the school when there is a case. So we provide any guidance, and if there were transmission at the school, we would make sure that the appropriate people within the school community know. We don't want to cause any undue panic, so we don't want to be too specific with providing that information.
And what will be done to ascertain the actual ventilation for each classroom? And what will be done should facilities be found to have inadequate ventilation?
So the Department of Health, we provide guidance on the ventilation that should be in place for the schools for best practices. But the Department of Health, we don't monitor or regulate necessarily the ventilation at each school.
Okay.
Open air windows and open doors will usually suffice. It's a definite improvement.
Yeah, when possible, as much fresh air, opening windows and doors is the best.
I guess the concern for those classrooms are the ones that are like the central air conditioning and the teachers are concerned whether there's going to be enough open air, whether there's going to be enough ventilation. So what would you respond to those teachers?
Yeah, we actually did a few site visits with schools late last year, and there was a school we saw that had the central air, and it isn't really a concern. I think the important thing is to make sure that the air that's being pulled in is fresh air, and then that it's being circulated properly. So fresh air in, and then the used dirty air out of the building.
Okay, Logan, what's your next question?
What would you advise for, sorry, traffic. What would you advise for teachers who have not been able to get vaccinated due to their health conditions?
For those teachers, oh, forgive me.
Go ahead.
For those teachers, I think we should be understanding, and if we should certainly not punish them if they choose not to teach in the classroom at this time. If there's a real reason that they can't get vaccinated, we should also be understanding if they need to reschedule, because there's a lot of times when someone just missed their opportunity to get a shot. But we'll do anything that's necessary to give people who are educators now a chance to go get their vaccination. And any of the 3 shots, in my mind, suffice. So I think we should just be understanding. If someone has some severe illness that completely prevents them from ever being vaccinated, we should probably wait till we achieve herd immunity in the state before asking them to make any kind of sacrifice and go back in the classroom.
So Karin, is that the same advice that the DOH is giving the DOE?
Yes, and yeah, it just be extra important to implement those and practice mitigation measures to the greatest extent possible.
I just want to be clear because it sounds a little different. So if a teacher cannot get the vaccine, what is the advice that the Department of Health is giving to the Department of Education on what flexibilities those teachers should have?
So yeah, because vaccinations, it's not required, and nobody should be forced to get a vaccine. As Lieutenant Governor was saying, there shouldn't be any any kind of stigma, but it would just be important to then practice those mitigation measures to protect themselves and others.
Okay.
Can I offer something here, Corey? I mean,
Please,
there
Lieutenant Governor, go ahead.
There are probably differences between a person. If anyone is unable to get vaccinated, it would not be fair to them to force them into any circumstance that they don't feel comfortable with. We'll make the vaccine available without any question. But if they have a health problem that can't do it, that's different. Now, if someone simply chooses, it's understandable and acceptable. Some people will simply choose and not believe in vaccinations, then we do need to accommodate them fairly. And that's something that if it's not resolved, we should still resolve, because maybe 20% of the population will never get a vaccine because they have some concern. And then we should find some other opportunity for them to contribute to the DOE, to their school, to their complex. Wearing a mask, personally, I think that there are sufficient concerns that we should find a way to help them.
Okay, thank you. Logan?
The next question will be, will we continue to use the color-coded tier system to indicate what percentage of the community is having COVID positive cases? And are schools planning to stay open at a steady level no matter how many cases are in the community?
Yeah, so as of now, we are still using the tier system that we provide in our guidance. CDC last month also released their updated tier guidance, which is very much aligned with what DOH has and has had since last year. One of the big factors is the implementing of mitigation measures that we keep talking about. So if there are instances where there isn't transmission on campus, but they are in a tier that maybe isn't all in-person learning, if they can implement those mitigation measures, then the school still may be safe to open and stay open.
Logan?
There are so many more. I'm trying to
I know.
find
I'm
ones as
watching.
we're wrapping up.
I'm watching all these, and it's just so many questions are coming in, and I think there's so many situations that are occurring in our schools, and this is all so new, and I guess there is a lot of concerns that are occurring.
Can I make a comment about that, Corey? Because I experienced this in a different setting, but I understand it. So when we opened when hospitals remained open, right? But there was a significant time when there was nothing other than masks that you could do, and people knew there were likely going to be individuals with COVID. The standard of care and the standard of approach was simply that everyone wore an adequate mask and every patient wore an adequate mask, and that prevented spread very well in hospital settings, which by their definition were at a higher risk because you had people literally coming there for treatment of COVID. And it worked well. It took discipline, it took thoughtful approaches, but you couldn't even socially distance because, again, there was no way. And I'm not saying that should be considered apples to apples. I know it's not, but it was a less stable, less safe circumstance, and we were able to mitigate risk. You will see these circumstances. I'm sure many comments and questions are coming in about what if this or that. If the same principles are adhered to, which is our teachers get a vaccine most of the time, and they always wear masks, we're not going to have a significant threat to our teachers. It's really going to be fine. Will there be some spread among our keiki? Sure there will. But shouldn't be very significant, and the disease has not been significant for children almost ever. So I think that really, once we saw that and experienced that, the healthcare community adjusted and became quite comfortable quickly. I don't know that will happen amongst teachers. It's a slightly different community, but I feel pretty certain. In fact, I feel completely certain that people will be safe. But I don't want them to worry too much. I don't want individuals to worry too much because we've come a long way and are better than ever keeping our cases down.
Okay, thank you, Lieutenant Governor. Logan, what do we have? We only have about 3 minutes left. So
Yes,
just probably
and
do a couple more questions.
This one should be pretty easy. Who is actually monitoring how schools are implementing measures and their plans as they open up?
Karin, are you able to answer that one?
So Department of Health, we provide guidance, and it's up to each school and the complex areas on how that guidance is implemented.
Is there any type of process where if there's a concern that certain measures are not being done at a school, is there anything a teacher or a DOE employee could do, Karin?
We don't really have a process. I am the school's liaison, so if anyone has any questions, they can reach out to me, and I can either address any questions, or if someone has any concerns with schools, we can work with the schools to make sure that they are applying the guidance to the greatest extent possible.
And I thank you both. You've been so open about willing to, address those concerns. So thank you. Logan, do we have another one?
Yes. What supports can the Department of Health and Department of Education provide schools in terms of community education so that our families know the importance of complying with health and safety protocols?
Yeah, so we do provide guidance and resources on our website. We do have a public health educator who is responsible for providing that information and guidance to the public as well.
Okay. And I would add, if it was a desired, if the school system desired it, if the teachers desired it, we'd be happy to have talk stories and information sessions much more regularly. My role is, as they call me, the COVID liaison, which is to say they don't know what the heck to do with the Lieutenant Governor who's a doctor. But I'm involved in every aspect of what we try to do. And I'm available. I will make other healthcare professionals available. We can Zoom as often as necessary, whether it's statewide or local. I don't want ever you to feel that you're out there alone. So if there are lots of questions, and I think there will be questions at different times, a week in, a month in, 6 months in, there will be different kinds of questions. Please don't hesitate and insist that we give you updated information and answer questions in real time. I'm happy to do that for you guys anytime.
Okay, with that, I want to thank you both. I want to thank Lieutenant Governor Josh Green for joining us today. Karin Ng from the Department of Health, the State School Liaison, and the Disease Outbreak Control Division. I know it was on the hot seat for some of these questions. I know that we don't have an answer for everything, but we really appreciate not only you being able to join us tonight, but your frank answers and your willingness to take up follow-up questions as well. We appreciate it so much for joining us tonight. And with that, we're going to transition right now. Again, thank you so much. You guys can log off. We appreciate that you having you on. What we're going to do tonight is we're going to transition now. Specifically, we wanted to do the first 45 minutes dealing just with the health aspects and dealing with those questions. But we also wanted to reach out to our HSTA members that have a lot of questions about, the actual application of the MOU that the HSTA has come up with the employer. So what we're going to do right now is I'm going to introduce our Deputy Executive Director and our Chief Negotiator, Andrea Eshelman. She will be giving us a brief description of the agreement. And then again, you can keep on asking your questions in the chat, but this will be more focused on, the MOU, the Memorandum of Agreement, Understanding that we came up with the state. Okay, so with that, I'd like to introduce Andrea Eshelman.
Thanks, Corey. Hi, everybody. I'm here to go over the agreement that was reached last weekend, and all of you that are members should have received a copy of that addendum to our MOU in your inbox on Monday. You can also find a copy of that MOU addendum on our website, hsta.org. So I'm gonna go over that agreement. It consists of approximately 11 different sections, dealing with all different sorts of things from health and safety to planning time and other things, all related to the plans to increase the amount of students and in-person learning or amount of students on campus and in-person learning that is occurring in fourth quarter. Following the briefing, we're gonna continue to answer questions as Corey indicated. We do wanna warn you in advance that we're not gonna engage in answering personal questions or questions related to individual teachers or situations on your campuses. And we ask that you not disclose personal information in the Facebook comments, as this is not a confidential location. If you have individual concerns, please go to our website and click contact, or go to hsta.org/contact, and you can submit a question confidentially, and we'll have someone follow up with you regarding your concern. So right now I'm going to summarize the main points of the new agreement. The agreement was reached with the state of Hawaii, the Board of Education, to amend the June 20th Memorandum of Understanding related to COVID-19 response. That's the agreement that many of you are familiar with from last summer, June of 2020, that has been in place since then. In addition, it modifies the letter that was sent out July 13th from the superintendent and an agreement that we reached subsequent to that MOU around distancing and masking. The addendum to the current MOU provides a framework to allow schools to increase the number of students returning to campus in the fourth quarter for in-person learning, especially in the elementary schools. Any area of the original MOU not modified by this new addendum will still remain in full force and effect. And I'll touch on a couple of those areas as I go through the addendum. So the first area I want to talk about is notification. Schools are looking to increase the number of students on campus. And so administrators, per this new agreement, must provide teachers no less than 7 calendar days notice prior to increasing the number of students on campus. If the school is planning to change their instructional model, in addition to this notification, there is a process that has been in the MOU since last June around the decision-making for instructional models. Some schools are planning to increase students and not change their instructional model. So those could be the same type of dynamic. They're going to keep with the AB, but increase the number of students, or they might be looking to move to, say, instructional model A, which is full in-person learning. So just make sure that you folks are having those conversations. A special note regarding this 7-day notification for the week of March 22nd to 26th, so the first day of fourth quarter. We reached this agreement last weekend, which was after the conclusion of the third quarter. And so most of our teachers are on spring break. Our 12-monthers are still working this week. If your school has not already notified you by last week, prior to you go out on break, that there was going to be an increase in in-person learning, there should be no increase in the number of students on your campus next week. So we have agreed with the employer that we're not going to do any notification to people this week. So if you haven't already been notified of that, then there should be no increase in the number of students on your campus next week. Teachers should also know that the Board of Education in their October 1st Board of Education meeting did pass a directive or a resolution requiring the Department of Education to have schools give 2 weeks notice for instructional model changes. Again, in-person learning increases is slightly different than instructional model changes. So if your school is looking to do an instructional model change, the Board of Education requires that there's a 2-week notice. The second area of the addendum is planning time. We knew that there would be a need to plan for reconfiguration of classrooms and or any sort of just general preparation for curriculum or planning for increasing the number of students who are receiving in-person learning. So if your school is planning to increase the number of students on campus in the fourth quarter, you may request to have 2 blocks of no less than 3.5 or 3.5 hours of teacher-initiated prep time. We do want to note a couple of things that we've been getting questions about just in the last few days related to this. So you do have to request it. It's not necessarily something that's automatically going to be given. However, we are hearing there's some great principals out there that are already planning, and they are just going to go ahead and give that time to their teachers and have already been looking at their schedules in the coming weeks. So bravo to those principals. But your principal does have to provide the time. There is no discretion about providing the time. There is language that talks about scheduling discretion, meaning your principal determines when and what date and times that you're going to get that block, right? So there's discretion in the scheduling. There's not discretion in whether they can give it to you. There have been questions also around whether a principal could just give you the 2 blocks in one day. So just one full 7-hour workday, and that is perfectly fine. There's nothing that prohibits that. And then when they are scheduling that 3.5-hour block, they should not be counting your prep time within there. So if you're just getting a half-day block, they can't say, oh, well, you already have an hour prep, so I'm only going to really give you an extra 2.5 hours. They need to give you the full 3.5 hours. And the time provided, we've been getting questions about that, about whether schools are going to be given extra sub days or what have you. That has to be worked out by your administration. What we were told at the table was that administrators would likely take it from their administration time that they already have, or they would take it from their asynchronous learning time. So meaning teachers wouldn't be doing active instruction. The next area in the addendum that I'm going to talk about is teleworking during quarantine. And so we had to address a section of our contract, which is Article X, that speaks about when students are sent home because of emergencies, teachers also stay home or don't report. And so we have reached an agreement on some language that if we do have teachers where their classroom has been closed down, they need to quarantine. In all likelihood, that means their entire class, their entire cohort is going to end up quarantining, that those teachers can continue to work from that remote location while they're quarantined. Obviously, if you become ill, that's a different dynamic, but it will allow that remote work. The next section was related to instructional models and delivery of instruction. So one of the things that we did not come to agreement with last summer, and quite honestly, I think in June when we were having these discussions, we never anticipated that schools might have to stay fully distanced for months and months at a time. And so we have come to an agreement on what's called Instructional Model D, which is a full distance learning model, as well as coming to agreement on the fact that some schools will have to run different models simultaneously. So they may have some students that are full in person, they may have some students that are full distance, and then they may have students that are on an AV type of schedule. And so we did put that into the language so that we know now there are 4 possible instructional models, a model A, B, C, and D. The other area related to delivery of instruction is the area of simultaneous instruction. It's also called concurrent or high flex. Those are other terms that folks use. This is when a teacher is asked to deliver instruction simultaneously at the same time to students both in person in their classroom as well as virtually from a distance. The HSTA strongly believes that the simultaneous instruction is not the best method of instruction. And we believe it does create a number of problems for both teachers and students. And so at the table, there was a lot of discussion around this concept and how we could support teachers. And what we came to an agreement on is that before a school looks at just going straight to simultaneous instruction, they really need to look at, they shall look at other options outside of that concurrent instruction. And one of those things that we do want to acknowledge is that some of our members would prefer to have that simultaneous instruction. So we've gotten that feedback as well, because one of the problems with not doing simultaneous is sometimes that means you then end up having to teach the same lesson twice in one day, maybe once in the morning to your in-person and then later on in the day to your virtual. Regardless, schools are supposed to look at other options. And then if a school does implement the concurrent instruction, teachers have the right to request and shall be provided the necessary supports around delivering that effective instruction. So we didn't come to a specific agreement on supports, but it's listed in the language around professional development, technology, and equipment. So at the table, some of the things that we talked about were things like the need to have computers that have enough processing power to both run a video conferencing program as well as other programs needed to do instruction, or other needs for cameras and audio visual equipment if you're going to have to be teaching both in the classroom and from a distance. And then the final area, which we just spent a whole hour talking about with the Department of Health and Lieutenant Governor Josh Green, is the health and safety piece. So this is the last topic that is probably the one that people have the most questions about and the most concerns. Hopefully that earlier discussion helped answer some questions, but I do want to run through a few key pieces that are in our language and our agreement. So first of all, regardless of the level of community spread, the schools are to follow the CDC, Department of Health, and the Department of Education's health and safety handbooks. They are also to use mitigation strategies and use them in multiple ways. So layer those mitigation strategies. It's not just masking, it's not just distancing, it's not just cohorting, to layer as much as possible the mitigation strategies. There are 3 core strategies that must be followed at all times. That includes consistent masking, meaning you need to wear a mask at all times. They recently changed the rule at recess, that kids are supposed to wear masks at recess. So that's an example of where the masking needs to be consistent. Hand hygiene and sending home students and staff when they are sick and keeping home folks when they're sick. So those have to happen at all times in all situations, right? The other strategies that are supposed to be used in a combination to the greatest extent possible is the cohorting of students. And we talked a little bit about that earlier with the Department of Health and Lieutenant Governor. The physical distancing, which is ideally at least 6 feet, and I'll get to that in a minute. Increasing the outside air ventilation, physical barriers, and cleaning, especially of the high touch areas. This is where the change has come with our agreement. In schools where 6 foot distancing is not possible, there needs to be open air ventilation. We know that a lot of people are concerned about that. I will note that the department has assessed the classrooms across the state. We are in the process of getting that master list. You can actually go to the DOE website and there is a list by complexes of how many classrooms have not met the standards of having adequate air ventilation, but that needs to be utilized. In addition, layering things like filtration systems and keeping students in cohorts. The new agreement will allow for classrooms to be configured at less than 6 feet, as long as those other mitigation strategies are in place. That means masking has to happen in those classrooms at all times. In addition, we have language around mask breaks. So where students and adults are going to go take off their mask, they are to be taken off outdoors or only in a well-ventilated area if an outdoor area is not feasible, and they need to be 6 feet apart. And so that's a specific agreement in our language. And then finally, because we had concerns about making sure teachers had enough space, we have language that requires that teachers must be provided at least 6 foot of distance between their desk and student desks. So regardless of how close the students are, you need to be able to have enough distance of 6 feet between you and the students that you are working with. So that's the highlights, Corey. I tried to do that as fast as I could. I hope that was good. And then we're gonna go to questions now, I believe.
Yes, thank you so much. That was the very fast version, but I know we're still getting a lot of questions. And Andy's great at this, so she'll do her best. But just realize I'm looking at some of the questions, and we'll do the best that we can, but we don't always have answers for everything. With that, Logan, what do we got first?
Hey, my first question is for you, Corey. Will state testing be waived, yes or no?
No, and that sucks. Unfortunately, that's not something that we have control over. I will tell you that our national organization, the NEA, pushed the Biden administration to allow states to request a waiver from standardized testing. Unfortunately, the state did not, the federal government is not going to grant state waivers. The one thing that they will allow, that we are pushing for, is to take away the accountability, so that if you don't have 95% participation, no student should be penalized for having either low scores or low participation. So my heart goes out to all those teachers. I know it sucks, doesn't make sense, but unfortunately that we don't have a choice on that.
Okay, what are we going to do when principals are not willing to have consequences for students who are non-compliant with safety protocols, like mask wearing?
You want me to take that one, Corey?
Please.
Yeah, so your contract actually already has some provisions in it around student discipline. And if you have a student who is not complying and is insubordinate, you do have the right to basically kick that kid out of your room. And a plan needs to be put together before that kid can re-enter to address the behavior. And so if you are having a consistent issue with that, I would definitely use the student discipline language in your contract to get it addressed.
And what should a teacher do if they have concerns about the sanitation of their classroom and believe it is not being cleaned every day?
Andy, go ahead.
So again, there are provisions in your contract about that. There's actually things that are listed in our current MOU. And so that should be something that your school APC should be addressing. And if necessary, we can file grievances. We've actually filed a couple of grievances for schools already this school year where it's not happening. Really important that you document and that you report it, and you make sure that it's regularly reported. You don't want to, go 2-3 weeks and then finally say something. You need to address it right away.
And I'll just say too, we do encourage, if you have questions, I do see that we are a bunch are coming in, but please feel free if there's something that you want to ask to put into the chat. Okay, and Logan, what's our next question?
Will teachers still be allowed to attend meetings online instead of in person?
Yes, that agreement is not superseded by this new addendum. We did not change that requirement. I will note, Corey, we are working on FAQs, and I know that's one of the FAQs that is in the list that I already have, and so we'll have that out by tomorrow. We're going to take some of these additional questions and add those as well.
And what if parents don't want to send their children back to campus?
Corey, why don't you address that one?
Sure. So there's a couple of options, and we're still tracking it. We don't have one answer per the entire state. But one of the things that was important is that distance learning still be an option. What we do believe for a majority of the schools is that there will be 3 options for parents. One is to increase face-to-face learning. 2 is to have their teacher, and I can see the whole debate going on in the chat about concurrent teaching. And the 3rd one is to do a distance learning program like K-12 or Acellus. We have heard, though, that some schools may be saying to parents, you either have to choose the face-to-face or the distance learning program. So we do not think there is a consistent standard across the state.
And then in line with that, in terms of simultaneous instruction, if a teacher is already being required to provide simultaneous instruction, can they ask to adjust how that is being required? Say, break it up throughout the day, or adjust the timing of it, or ask to not do it at all?
I think it's definitely something that should be revisited, and they should be given enough supports to be able to implement it. And so that's something that can definitely be revisited by your school's COVID response committee. Usually that's your school APC. And so if you guys are having those kinds of concerns, you can work with your UNICEF director if need be to schedule a meeting and have that issue addressed with your principal.
And so back during the summer, we voted on an instructional model for our school. Now we're being told that we're going to go to Model A. Do we still need to have a vote as a faculty?
The requirements for the collaborative discussion and potentially a vote if there's not consensus are still in the MOU and still in full force and effect. So those provisions still need to be followed if your school is going to change instructional models.
So item 8B states where physical distancing cannot be achieved, ensure open air ventilation, utilize air filtering systems, and keep students within established cohorts. Does this mean that all three criteria must be met to breach the 6-foot distancing? Because then it says the greatest extent possible appears to be referencing 8Bs 1 through 5.
Can you repeat the last part again? Then the great, I heard the first part, which I understood,
Yes.
but can.
So the greatest extent possible wording appears to reference the mitigation list items 8Bs 1 through 5.
Correct. Correct. So yeah, so 8B 1 through 5 is the combination of possibilities, right? And that the ones that are higher on the list are supposed to be used first. I will just note that this language and this list is straight out of the new DOH guidance that actually finally got published this past Monday on their website. So we will be linking to that on our FAQs. So the expectation is that they need to make sure that those things are happening when they are going to be doing less than 6 feet, when that physical distancing is not happening. One of the things that we spent a lot of time discussing at the bargaining table was the issue of air ventilation. We are very concerned about any classroom that doesn't have adequate ventilation, that they're looking at less than 6 feet. That should not be happening.
And for item 10, where teachers shall be provided at least 6-foot distance between their desk and the nearest student desk, is it head to head from teacher head to student head, desk to head, desk to desk?
Yeah, so it is what we have agreed to with the department is measuring from student seat to the edge of the teacher's desk. The student desks can vary in size.
And is there someone that a teacher could reach out to in order to request that they come to check their ventilation?
That's a good question. We know that all of the classrooms were assessed statewide, and there is a master list. We're working to get that master list. I would refer the teacher back to their principal and ask for what the report was on their classroom. That's actually on my list to do and follow up with the department, is to get that list. We know that on the current metrics listed on the DOE website, there are 1,300 classrooms listed as not being adequately ventilated. However, we were told at the bargaining table last week that that list has since been reduced because they have been able to get more windows open, bring in HEPA filters and things like that. So I don't have a specific person that I can direct people to other than talk to your principal. They should have a list of the report.
Does the teacher work time need to occur before the increase in students on campus, or can the teacher request this at any time during the 4th quarter?
So the intent of the agreement was that those 2 blocks of 3.5 hours would be provided before the increase in the number of students. However, It also was understood at the bargaining table that we may have schools that already plan to increase come March 22nd, and it realistically isn't possible to schedule a teacher during the spring break to be able to get that time beforehand. So the intention was to provide it beforehand, but it can be provided after, and the commitment by the department was as quickly as possible it would be provided. It was for the express purpose to reconfigure the classroom and to do the planning that was necessary as that transition occurs.
Do after school programs on campus need to follow all the protocols that are put in place within the classrooms?
Yes. Those health and safety measures are to be followed by everyone on campus.
And what do we do if admin does not follow up with these guidelines and we've tried as an APC? What do we do next in terms of getting support?
You need to talk with your UNISERV. You may need to consider filing a grievance. If that's not something people are comfortable with, there are other methods that you can file complaints with the department. And so I would just advise you folks to reach out to our staff and get support from a UNISERV to get guidance on possible issues. I will tell you that in some cases this school year, I have personally followed up with the department where we've had reports of, say, a principal who's not wearing a mask or things of those nature. If that gets escalated to Corey's and my level, we have no problem making phone calls.
Okay, I'm trying to sort through some of these that are more health related questions. Can you remind people where they can find the new language?
So it's on our website at hsta.org. If you go to the main website, it will, on the main page, there's a link to our new agreement. You also should have been emailed a copy of it on Monday around noon. We will also be sending out, I believe, another member matters tomorrow, Corey, with our FAQs and the agreement again, I think is what we're doing.
Are we still adhering to instructional minute requirements?
Yes. There's no change in that.
And for double desks, can students be seated at double desks? Do they need to have an additional barrier?
So we actually talked about this quite a bit at the table, and we had a conversation with Dr. Kemble, the state epidemiologist, and right now the Department of Health has indicated that there is no minimum requirement. So technically, they could have students sitting at a double desk. The most important requirement is that they have their mask on. But we are supposed to be layering, so it's, adequate air ventilation, masking, cohorting. Those things are the big ones. You could have a physical barrier, but it's not expressly required.
And is it allowable for part of the 21 PD hours to be used toward the additional prep time so that they can extend the workday, but have that time used?
That's admin time. I would tell you that I have no problem with it. HSTA would not have a problem with it. I don't know if your principal would have a problem with it, but there's nothing that HSTA has a problem with.
If there are other mitigating measures, then are we saying it's okay for students to sit next to each other, especially if the number of students in a class is a larger number?
So I want to take that one first. The two biggest concerns that we heard from teachers was how many students are going to be in a classroom and concurrent teaching. The answer is we don't know yet. The feeling is that if we allow all students to return, that all students will return. And that's not what we've seen across the country. That's why the distance option was so important. Schools that have returned to basically when they opened up the doors for all parents to allow their children to come back to school, there wasn't always this mad rush. So we don't believe that for across the state, there may be exceptions to the rule, but for the most part, we still think there's going to be some sort of distancing that's going to occur until students can get vaccinated as well.
Is the DOE honoring the recommendation by HSTA regarding teachers having both doses and 2 weeks before returning to in-person learning?
So there was never an agreement that this had to happen before students returned. We were happy that in Hawaii that there was a priority that was made for teachers. And teachers have been, even since February, allowed to get their vaccination, and that's something that HSTA has been encouraging. But there's no rule that says that they cannot return until it's 2 weeks afterwards.
And this question might be added to Andy's list of things to follow up with the DOE on. Were spaces like libraries checked for ventilation? And or how were they assessed?
We can double check on that, but my understanding is that every facility statewide has been assessed. So it's not just, because remember, it's not just about students and teachers, it's also about our front office staff, our cafeteria staff. And so my understanding is that all of the buildings were assessed. But I mean, I can add that to our discussion about ventilation with the department.
Sorry, I'm trying to sort through some of these.
I'll just say one while you're doing that.
Okay.
I want to appreciate the positive comments. I know this is not always easy, but I do notice in the chat, thank you, Kyoki Fraser. It was very important that just to say that when we were doing these process, we do believe that the best thing we could do for our teachers is try to make sure that there were certain provisions that were agreed to, and that got to appreciate sometimes that we have a union. Otherwise, in other states, are just people are going in with no masks, no rules at all. So, Kyoki Fraser, we do appreciate the nice comments you put in the chat.
Okay, sorry, I'm still trying to sort them out.
Okay.
For secondary schools, is cohorting possible?
Yeah, that's one of the questions we actually have on our FAQs. Frankly, it probably is not. As we heard the DOH folks, as well as the Lieutenant Governor, kind of dance around the question earlier, I think, I forget exactly how you phrased it, Logan, but is there a proper size? We are hearing rumors of high school principals trying to argue that the cohort is 3,000 kids. That's not a cohort. That's not reasonable. The purpose of cohorting is to have a concrete, amount of kids that then, if they have to do contact tracing, it's manageable. But there is no specific number. And at the high school level, you can't do cohorting without significantly impacting the instructional program for the students. It really isn't viable from what we can see. And we've heard a couple of, maybe in a middle school concept, you could stick with 2 teachers and, a larger group of kids or whatever, but at a high school level, it's not really viable. We've not seen a model that'll work. And I see Corey laughing. Maybe he wants to add to that.
I mean, Campbell with the 3,000 students. And first of all, I just want to correct. I learned that Kyoki Fraser is a principal. So thank you so much, Kyoki, for joining us, and we appreciate your kind words. It is much more difficult to do cohorting at the secondary level. That's why we've seen in the comments from the superintendent that there is a greater push to do the more students on campus at the elementary level. And I still think at the secondary level, I will tell you, even at my school at Campbell, at the best, they're still trying to just do hybrid, maybe 1 day out of every 4 days to bring students on campus. So we do still expect that at the secondary level, they're going to be doing some sort of hybrid model for many schools.
Both Corey and I are intimately knowledgeable of this because we both have students in high school. So this is
at some of the biggest high schools, no less.
This is very personal for us.
I have a question for you. Are HEPA filters going to be provided to every classroom or work site with an air conditioner?
Our understanding is that they were prioritized for rooms that were identified as not being able to have adequate outside airflow. Just because you're on an HVAC system, an air conditioning system, that does not mean it was deemed automatically to have inadequate outside airflow. But our understanding is that they prioritize those areas that do not. Again, this is a follow-up that we're working on. If you have concerns about that, I would direct you to your principal and to ask for what the report is for your campus and whether your classroom is identified as a room that does not have enough outside airflow.
And do you know how these rooms were identified? Do you know what the process was for assessing ventilation?
That was handled by AS Tanaka and his crew for facilities. When we put out our FAQs tomorrow, and you can actually go look it up right now if you want, our understanding is that they use the CDC guidance for assessing the air ventilation into buildings. And so there's an extensive guidance on the CDC page. There's also some of that guidance in the Department of Health handbook that got, or guidance that got reissued this week.
And do office hours and asynchronous lessons count towards instructional minutes?
Yes, that's our understanding.
Sorry, the others that are coming in are more health related. Like, is rapid testing on campus a goal? And can we get it as a priority?
So we actually have that as one of the questions that came in earlier this week. So I will be addressing it in our FAQs that we're putting together. We know of no plans to implement rapid testing on any campus. A couple of things that comes into play there. One is, frankly, we don't have the staffing to implement it, nor does the DOE really have the resources to be able to do rapid testing for 100,000 plus people on a regular basis. The other part of it is that the testing, folks can get, testing is widely available. And so if you are identified as someone that perhaps was exposed and needs to get tested, it's very simple to go get a test. I myself will share that I've been potentially exposed twice so far. And I've had to go get tested. I've been able to get it within the next day. So it's not something that we prioritized to try and secure, because we felt that if we have the money for staffing and things, that should be focused on instructional programming and supporting the teaching that needs to get done.
If teachers were notified on Friday, so on March 15th, right before that, no, that's not the 15th, the 12th, the 13th. I can't remember my days. I'm sorry. On the last day of the quarter,
12th.
if they were told, okay, we're going back face to face, could that start on the 22nd?
Not unless they had a discussion about changing their instructional model, because a face-to-face would be moving to a model A. So there would be a potential violation of the contract if they were just told on the 12th, you're going to model A, and they did not follow the MOU for the decision-making process.
And why is this happening during the last quarter? Are they trying to burn us out?
Ray, would you like to address that?
I'll take that. And I see in the chat, first of all, I can see the stress that some teachers are having just with concurrent teaching. And sometimes I wish we could do a magic wand and solve the problems. We can't. There is the bigger push to have more students on campus. There has been a lot of evidence to the psychological effect. Both Andy and I both have kids, and we both know how difficult it has been on kids to do this. But the biggest thing is we try to make sure, and this has always been our priority, is to make it safe. I think some of the things that have changed that allow more students on campus, and we have said this over and over again, we totally resent the idea of reopening schools for all the teachers that have been working since the very beginning, and for teachers that have been on campuses. Is not reopening, it's just bringing more students on campus. So the couple of factors are, number one is that we have given in Hawaii, teachers have had the opportunity to get the vaccination. So if they're vaccinated, then for many ways it's safer for them. It's not completely safe, but it's safer for them. Number two, the choice has to be given to parents to allow. And if a parent says, I feel that it's safe for my child to go back, and then that option should be given. And the third thing is that Hawaii is different. We do have a low case count. So if you combine all those things, at some point, there's got to be some point where we feel that it's safer for students to return. I will say that as an organization, we're going to carefully watch the numbers, and we will continue to advocate if we believe that at some point it does not become safe.
If I contract COVID, does my leave come out of my sick bank?
If you become ill from COVID, you would use your sick leave if you need to stay home to recover from COVID. If you believe that you contracted COVID in the workplace, you do have the right to pursue a workers' comp claim. And so we would encourage you to go through that process if that's something that you feel you can. I will note one of the, just generally in labor relations law and dealing with that right now, this is a problem across the country. It is very difficult to prove that you contracted COVID in the workplace. But if you feel that you have a claim, we would encourage you to file it.
All of the MOUs expire at the end of our contract this school year. Will all of this need to be renegotiated in a few months?
We are actively in what we call successor negotiations right now. We actually have bargaining with the state tomorrow. And yes, the answer is that any of the agreements that we reached from last June, this most recent addendum to that MOU, will all have to be renegotiated and reached for possible renewal, or in part renewed. We have to do that because everything expires in June.
And if I could just answer too, some of the questions is about why didn't HSTA do this or why didn't HST do that? And you have to understand, the pandemic and the consequences is not something that we could have predicted when we were working on our contract. And what we are currently, just the conversations we're having with the DOE is impact bargaining, which is, basically both sides have to agree this is good for everyone. So it's not like HSTA could, be able to get whatever we wanted.
So my next question is a follow-up to the COVID or contracting COVID and taking leave question. If I'm put on quarantine because of a potential exposure on campus, but I'm unable to teach virtually or perform my duties virtually, what happens?
There is quarantine leave available from the department. And so there's a memo, it's linked on our website, and we will also have a question on this in our FAQs tomorrow that we're going to be putting out. And so you can take quarantine leave, and that's a paid admin leave. So if you're exposed at school, you get told you need to quarantine, there's that option.
If numbers increase in the community or on campus, what are the steps that would limit the number of students on campus?
Say that one more time. If the
numbers, the number of positive cases in the community or on campus increase, how does that impact or limit the number of students on campus?
So generally, there is guidance from the Department of Health, right? And some of you may be familiar with that color-coded metric that they put out. That is deemed as guidance from the Department of Health. There are decisions that are made at the school level about whether you will change your instructional model. I will use, we have a Maui school that had, I believe it was 3 positive cases within the course of a week. And they announced that they will be distance learning for the first 2 weeks after spring break. So that's giving a 3-week window to keep everybody home, including the spring break. And so those decisions are made at the school level, looking at all of the factors. The department, we've asked about this before, the department is very vague. There is no cut and dry, black and white, chart that you look at and this many people in the community and this many people in the school or what have you. But if there are a number of positives in the school, from what we have seen, the schools go back to distance learning. We saw that out in Kapolei earlier this year. There was a number of positives within a couple of day period. They shut the in-person learning down. We saw that on Maui. And so that's what we would expect, especially if it's on campus.
And I'll just add that, we are pursuing at the legislature a bill that would say how many cases are by school. I know in the first hour we were discussing, they don't want to share that information, but right now that is still a bill that is moving and something that we're going to keep close eyes on, as we bring more students on campus. If it looks like the trend is it's getting unsafe, that is something definitely we will continue to advocate for.
The state sent air purifiers to schools, and they were put into certain areas. Are teachers able to request air purifiers for their classrooms?
I don't see why they couldn't request, but if you're asking if there's like a specific guarantee, there isn't a specific guarantee that they have. But as I indicated earlier, our understanding is the priority for air purifiers and HEPA filters were for those classrooms who had less fresh air ventilation, who had been identified as needing more ventilation and filtration in those rooms.
Why are all school health rooms not regulated the same, such as having sneeze guards or barriers?
So I can just broadly talk about this. We do not represent the SHAWs. We represent the bargaining unit 5, so we don't represent the school health aides. There are guidance or guidelines in the DOE health and safety handbook that are supposed to be followed for those rooms. And if that is not being followed, it can be brought up generally as a health and safety issue by our APC. But if that individual employee feels that their working conditions is problematic in that room, then that SHAW should be contacting their union.
And I'm not sure if you're able to answer this, but should fans be used to help with ventilation? And if so, how?
There is guidance in both the Department of Health as well as the DOE's health and safety guidance, as well as CDC. We will have a section on ventilation on FAQs tomorrow that do talk about utilizing fans and the methodology to use to increase the flow of fresh air in and out of a room.
Should we have waited for the numbers following spring break travel to have come out before bringing students back on campus?
I mean, I have my own opinion about that, but I think a lot of principals are making that decision, and a lot of schools are gingerly approaching the increase of in-person learning. I will just note Stacy Kunuhisa, who's a principal at Kanoilani. My kids went there. She has been on the news the last couple of days talking about, it's a lot easier said than done, and she's taking, I think, a gendered approach, and they're only bringing back their lower elementary. So that would have been a possibility, but it was not something that the department really was taking into consideration. And Corey, I don't know if you have anything to add.
Yeah, there's not going to be one answer on this one. We know that some schools are already have that full choice. We know that some are going to go all the way to April, potentially to do that, and some will never for the fourth quarter be doing this one. So I mean, there's not one answer.
I will note, I think part of the dynamic of the travel is that folks have to have that negative test or quarantine coming back into the state. And so it isn't viewed as such a problem as perhaps in other states where people can just kind of travel interstate freely.
Do you have any predictions of what the school year will look like next year?
That's a good question. I wish I had a crystal ball. I think what happens in fourth quarter is going to bear a lot on what happens with us at the bargaining table. We're going to really push hard to continue to have all of the protections that we possibly can get for teachers. One piece that is going to be critical for our community is that our community gets vaccinated, that as many adults as possible get vaccinated, because the more people we have vaccinated, the lower our numbers will be, so that the faster we can get to that quote unquote herd immunity number.
Yeah, so I think that there's going to be a couple of factors we're going to watch. Number one is, what vaccinations are being made available to children. Two, to see what happens over the next quarter. But, I think this is why this push is happening now, because a lot of the factors that are going to happen at the beginning of next school year are going to be similar to now. And at some point, we've got to be comfortable with the idea of more students coming on campus. We can just hope that as the numbers get lower, but it's never going to be perfect. And I just saw a comment in the chat. I want to respond to this one, because someone was asking, why are we doing distance learning? I'm doing distance right here, and we're not asking that of our teachers. And the thing is that I know teachers have this big radar for hypocrisy. We're not asking that for society we don't do things that are safe. We want to make sure everyone is safe out there. But we do realize that certain things are very difficult to do through social distancing. There's a reason why kids come onto campus and why they interact with teachers, because it matters. And I think for all the teachers that have been working through distance learning, they've missed that interaction with their kids. They've missed being in the classroom. And that's why we've heard from members on both sides of this issue. For those that have been just arguing that it's too early, I've heard from teachers that are saying we've waited too long. And so just because we're trying to do this does not mean we throw the baby out with the bathwater and try to make sure that things aren't safe. But I think that, we know how important it is, and we want to make sure that our kids are trying to get the best education possible.
I'll note, Corey, I'll just add, for the record, I just want to kind of speak up for my staff, right? So I'm the Deputy Executive Director here at HSTA, and the Executive Director and I take our employees' health really important, or we take it seriously. The vast majority of our staff have not been in a position to get vaccinated yet. They were not prioritized as our members were. And so our folks are still waiting to get vaccinated. And so that's a dynamic that is affecting us. I personally have not been vaccinated. My husband is considered an essential worker. He works for the cable company. He has, but that's the situation with our staff as well. If Corey and I were in the same room, frankly, we'd be talking to you with masks, because that's the proper thing. And so we're going to get a better experience for you folks by being at a distance.
The biggest spacing issue is in the cafeterias. Can teachers advocate for new structures or areas to be created for meal times?
I'll take that one first.
Yeah, go ahead, Corey.
There are many issues that we can try to help with, we can put into the MOU, and we can advocate for. But a lot of these issues are being happened school by school. I do want to thank all of our school level leaders who have had a year like none other, and I've always been out there trying to advocate for all of you. So, I just want to put it out there that there's still advocacy that needs to happen at the school level. And so you asked the question about, are there things you can still advocate for at the school level? Absolutely. And if you look at the MOU, there are many points where it's still going to be up to a school and to a teacher to still advocate to be able to follow the MOU.
As we go into the new negotiations, is there a possibility of reducing class size to accommodate distance in the classes? This would mean adding teachers and sections.
So generally, I will tell you that we have proposed class size limits in our proposal. We have not had the opportunity to have a lot of dialogue on the proposals. We are, again, going into bargaining tomorrow and Monday, and we'll see what the future dates will hold. So it is something that is important to us. The number one issue with class size specific to the distancing is that we don't physically have enough buildings. So even if we negotiated it, there's not a magical building genie that's going to give us enough buildings to create those classes. And as Corey loves to remind folks, and very rightfully so, we don't have teachers. We have a teacher shortage. So even if we got the magic building genie, we're not going to have enough teachers to teach. So, but it is something that we have as a priority on our bargaining.
I'm just saying that that is a conversation happening nationally. It is always in Hawaii. The money is always a fighting issue that we have to try to fund, but I wish.
Maybe
So I
Corey,
have two questions that.
oh.
Oh,
I was just
Go
gonna
ahead.
say, Corey might want to mention that we did get positive information last week based on the newest relief money, and the governor has indicated that there will not be a need for layoffs or furloughs. So that was happy news last week.
And I'm gonna give a shout out because I heard this, that some people have worried about that if they become teachers, there's no jobs because of the layoffs. You got to convince them we need them to go to school because we need those local teachers. So if you know someone out there, tell them to, turn in their applications and become a teacher.
so I have two questions that go together that will probably be a great wrap up for us.
That'd be great.
Can we request that the DOE have a plan for fall reopening by the end of, and how can we make sure that things get better for schools as we end this school year and get ready for the next year? Or how can we make sure it's better for us as teachers and for the community?
So, Andy, I'll take that one first. I'm so proud of the advocacy that all of our teachers have had throughout this year. We have gone to the Board of Education and the legislature to continue to advocate for safety, and we will continue to make sure that there is some sort of plan. I think that that's not just a request of teachers, but of principals and of parents as well. And that's something that we will continue to advocate for. And I do hope that we're going to learn a lot of lessons this quarter so that we can learn that for next school year as well.
I'll just add, if you folks have listened to the recent Board of Ed meetings, they are pushing the department on this around a plan, that they need to have a plan. They need to not be, building the plane, as we frequently hear principals talk about, in the air as it's flying. So we continue to push for that. We also believe that there needs to be a concrete plan on what will happen. I do want to note that that plan may be subject to collective bargaining. And so our negotiations play a huge role in what that working environment will look like for next school year.
Okay, I think that will be it, Logan. Are we good?
I think that could wrap us up tonight.
Okay, so thank you so much. As we wrap this up again, I just want to thank our Deputy Executive Director, Andrea Eshelman. If you notice, we're so lucky to have her. You can't stump her with any question. And that's why it's so important that we do these things so our members can hear you. I also want to thank Osa Tui, who has been sitting there answering those questions. I want to thank Logan Okita, who is doing a great job of trying to monitor all the questions and write them down as well. Kelly Ka'ana'ana as well. Thank you so much. I want to thank our communications team, Kyoki Kerr, Terry Inafuku, and Chris Schubert, who allows HSTA to do this. Our communication staff, there's only 3 of them, but it seems a lot larger than all of that. So I want to thank that. I do want to thank you as well. I appreciate the questions, and some of them are tough, but I want to say that when we did this Facebook Live, we knew there's going to be tough questions. And it's very important as an organization that we're willing to deal with your questions, even if it's, tough against HSTA, because we want you to trust us and be there for all those times. And beyond just today, we have a great staff of UNICERFs out there to help you as well. And I do again want to thank all of the volunteers across the state that are trying to help as well. This is not going to be easy. The pandemic has not been easy. I do want to thank, that we all have to take care of each other. I cannot say how many times I was watching in the chat, people talking about stress and how hard it is. And so please, be there for each other and for your fellow teachers. And as we are coming back, remember too, that it's been very difficult on our kids, that some of them have, been basically in their rooms the entire pandemic, and they need our teachers more than ever. So this eventually will end. I'm starting to see the light. More people are getting vaccinated, and we can do this all together. I'll just say this. So if you miss any portion of this live stream, The video will be archived on our Facebook and YouTube pages. Things are constantly changing. If you watch our Member Matters as we come out, because Andy, it is coming out tomorrow, the FAQ.
Yeah, I believe we will have a mini update with the FAQs and a reminder of the new agreement.
Okay, so we're going to try to keep you update as much as possible. And again, HSTA is here for you. So again, thank you so much for being members of HSTA, and be safe. Thank you.
Thanks, everyone.